Today, I'd like to tell you about a couple, Amy and Bob. On a rainy Vancouver day, Bob and Amy were driving home from the supermarket when, boom, they got into a car accident. After waking up at the hospital, they were both diagnosed with serious spinal cord injury. They were feeling the loss of movement in their legs, numbness in their fingers, and worst of all, loss of bowel control. The things I just listed are only a few symptoms that 86,000 spinal cord injury patients across Canada are experiencing. And during the period of sadness and anxiety, what the couple didn't know is that inside their body, there are structural and functional changes happening to their heart. Studies showed that patients with spinal cord injury have a smaller heart volume and altered systolic and diastolic function. These changes, along with other changes together, now make cardiovascular disease a leading cause of death for spinal cord injury patients, with 3 to 5 times greater risk of heart disease compared with healthy individuals. Furthermore, it's been shown that in the general population, males face a greater risk of heart disease than females of similar age. Now, that makes me wonder, if there are sex differences for cardiovascular disease in the general population, how would Amy and Bob's risks differ now that they have spinal cord injury? And this question drives my thesis project. I aim to examine the sex differences in the risk for cardiovascular disease associated with spinal cord injury. And by accessing the Canadian Community Health Survey, I was able to perform statistical modeling on more than 60,000 individuals across Canada using their self-reported data for heart disease and spinal cord injury status. And results suggest that for both populations with and without spinal cord injury, males have a greater risk of heart disease than females. And that's quite expected. What I found surprising is that the increased risk of heart disease for males are amplified in the spinal cord injury population compared with the able-bodied population. These preliminary findings have strong clinical relevance, as it would give physicians and policymakers insights to the importance of sex-specific considerations when implementing targeted prevention strategies. And I'm thrilled that my work potentially contributes to improving the lives of 86,000 Canadian patients just like Amy and Bob, so that they won't need to suffer from cardiovascular complications in the future. Thank you.